Every minute, your lungs move thousands of liters of air in and out of your body. But for millions of people, breathing is not automatic. It's a struggle. Today, we'll explore what actually happens inside your lungs when you have obstructive lung disease. Conditions like COPD, asthma, chronic bronchitis, and emphysema. Let's take a look inside. Obstructive disease means one simple thing. Air can enter the lungs, but can't leave easily. Imagine breathing through a straw. You can inhale, but exhaling feels slow, tight, and difficult. This happens because the airways become inflamed, swollen, full of mucus, or they collapse when you try to breathe out. The result? Air gets trapped inside the lungs, like a balloon that never fully empties. In a healthy lung, air moves through wide tubes into millions of tiny air sacs called alveoli. These sacs fill with oxygen and release carbon dioxide smoothly. But in obstructive disease, the airways narrow. The walls thicken. The muscles tighten. And in some conditions, the alveoli break down completely. This makes breathing out slow and incomplete. That's why many patients feel they can't empty their lungs, because physiologically, they can't. In asthma, the muscles around the airways suddenly tighten. The airway becomes narrow like a squeezed tunnel. Symptoms include wheezing, chest tightness, and shortness of breath. The good news, asthma is largely reversible with treatment. In chronic bronchitis, the airway lining becomes swollen and full of mucus. This blocks airflow and causes a chronic productive cough. The definition is classic: a cough with mucus for at least 3 months per year for 2 consecutive years. In emphysema, the alveoli, the tiny air sacs, are destroyed. They lose their structure, merge together, and can no longer push air out. This causes severe air trapping and shortness of breath even at rest. COPD is a combination of chronic bronchitis and emphysema. It often results from smoking, pollution, or long-term occupational exposure. The most important test is spirometry.